My name is Peiru, and I'm the CEO of KeyReply. So what we do is that we provide a healthcare AI operating system for hospitals and healthcare providers to build patient engagement automation workflows. So a lot of it has to do with how we manage the whole patient journey from the time where they're looking for a provider, they're making an appointment, they have questions to ask, all the way till after the appointment, post-discharge, where we do constant follow-ups, we provide higher levels of care, and we make sure that we are with the patient every step of the journey.
Wow, there's a wonderful scope in there and a lot to cover.
That's right. I think there are a lot of opportunities, like we mentioned in the panel yesterday about healthcare marketing. Like, nobody likes to be marketed to, nobody wants to be sold something or told what to do, but there are already a lot of low-hanging opportunities that are already within the whole patient journey that patients don't feel like they are being, I would say, taken care of to the next level, right? It's not just like the moment they step out of the clinic, it's episodic, right? It's really about the whole journey. And I think there are a lot of opportunities that we can do more in terms of enriching the experience, providing more levels of care to know where they are at, and just giving very relevant suggestions on what we can do.
So let's dive into that a little bit more, like with that patient experience and that low-hanging fruit and making the patient feel a little more engaged or nurtured in that patient journey. What are some of the lessons that you've found in this?
Well, because we do a lot of automation at scale with AI, and I think that there's some misconception of what AI is, and some people are like, okay, is it safe? Is it trusted? Do we know what's gonna do? I think there are a lot of ways we can adjust for risk and we can test for safety, given that it's healthcare and, lives are at risk. We can make sure that at every step of the way, we tune what we are willing to do and make sure that it's all in line with the care protocols and pathways that the provider has. And with that, we can collect interaction data. We can be relevant to them both in terms of demographic, psychographic profiles, so that we don't treat them all the same, right? We treat them like how we want to be treated as consumers. And with that, I think there's a lot higher levels of engagement that's already embedded within every single interaction that we can do. And I think there's a lot of potential in that hasn't been fully maximized, and it can be done in a safe way. Yeah.
So then let's look to the future. How do you maximize it? What will that look like?
I think a lot of it starts off with understanding at each step of the patient interaction or journey where are the value add points we can bring up, right? What are the points where patients they do need help, they are reaching out for help, or maybe they don't want to wait for information, they don't want to be maybe traversing different areas and trying to find out what sources of information are true. We want to be at wherever they are, meet them at where they are, making sure that we're always sending only relevant information, and at the same time, maximizing the efficiency of our staff members to make sure that they are not doing repetitive stuff that they don't enjoy doing. So a lot of this has to do with operationalizing it and putting in automations in the areas that supplements and adds value to the work, and not add on more work to the existing staff, right? Because they feel like, I'm already, so busy. Don't add on another workflow to me. Don't make me manage another system. So I think putting everything into existing workflows, there is, I think, a lot of potential with that.
Yeah. Well, as a clinician, if you can please put as much into existing workflows as possible, that'd be amazing.
I think minimizing onboarding time, minimizing change management is very key. Ideally, both clinicians and patients don't have to learn something new to make it happen. I think that's, to me, the highest level of automation we want to bring, right? Yeah. Just magically things happen, and it's more or less possible today. Of course, it's not exactly to that extent, but I think with the maturity of technologies and people's attitude towards that, I think it's pretty much possible in the very near future.